Are you struggling with exhaustion, unexpected weight changes, or skin problems? Are you wondering if levothyroxine is the answer? Whether you've just been handed a prescription or you've been on it for years and still have pressing questions, this is the video you've been searching for. Hi, I'm Dr. Richardson, and today we're unraveling the mysteries of levothyroxine, commonly known as Synthroid. We'll tackle its purpose, correct usage, and all the side effects you should be aware of. So whether you're new to this medication or have been taking it for years, you need to watch this video to fully grasp what's going on inside your body. Stay with me because this information can change your life. Levothyroxine is one of the most commonly prescribed medications out there and has been around for decades. It's given for conditions where your own thyroid is not working right. It works as a synthetic replacement for your own thyroid hormone when your body isn't doing the job. Thyroid hormone plays a crucial role in your body, acting as a kind of master regulator of many of the essential functions. It helps to control your metabolism, regulating how your body uses energy, and it also influences your heart rate, body temperature, digestive function, muscle control, brain development, mood, and bone maintenance. In short, thyroid hormone ensures that many of the body's vital systems are working in harmony, making it essential for overall health and well-being. When this isn't working right, the symptoms start to fail, so you may notice symptoms like fatigue, weight gain, constipation, increased sensitivity to cold, dry skin, hair loss, muscle weakness, and slower heart rate. Additionally, low thyroid levels can lead to memory problems, depression, and even menstrual irregularities in women. These symptoms can be more subtle at first, but can become more pronounced as the condition worsens, significantly impacting your daily life. This is why, if low thyroid is the source of your symptoms, taking this medication can be a life changer. Levothyroxine comes in various strengths, ranging from 25 to 300 micrograms. Now, how much you should take is going to depend a lot on the different factors that your doctor is going to look at. This isn't an exact science though, so there may be a little trial and error to find out the right dose for you. When I prescribe it, we'll pick a dose that we think may be the best, but then we recheck the blood work in 6 to 8 weeks afterwards to see if more adjustments need to be made. We really want you to be successful when you take this medication, so over the years we found out some tricks that if you do them, are going to help this work a lot better. The first of which is to focus on consistency. You want to take it at around the same time each day. For it to be absorbed best, many suggest taking it on an empty stomach in the morning, ideally 30 minutes before eating or taking any of your other medications. If this is a struggle because you can't get up early, or if you have a lot of different medications, taking it at night before bed can also be an option. So this would be a great conversation to have with your pharmacist as they look at all the different medications that you're on and see what's best for you. The most important thing you can do is to be consistent in how you take it. That way your doctor can adjust your medications to adapt to your specific lifestyle. Now that we're on the subject of medications, this is the area that most can interfere with how well your thyroid medications can work. Different medications as well as supplements can significantly impact how much thyroid medicine you may need to take. Some of the biggest offenders are medications like birth control pills, estrogen and testosterone, heart medications like amiodarone, some anti-seizure medications like phenytoin and carbamazepine, and medications for mood like lithium. There are some supplements and over-the-counter medications can also interfere with the absorption of your thyroid hormone. These include supplements for iron, calcium, magnesium, and aluminum-containing antacids, as well as fiber supplements. If you're on any of these things, you should avoid taking them within 4 hours of taking your thyroid medication. Now, of course, for specific advice in your case, you should always talk to your doctor and your pharmacist. But in general, just because you're on thyroid medication, it doesn't mean that you can't take these medications or supplements. It's just that you need to be consistent with when and how you take them so your doctor can adjust your dose as you need to. It also means that if you're starting a new medication, it may be necessary to check your thyroid more frequent in order to make sure that the dose is right. Now, this would be a great time to make special mention of the supplement biotin. This is something that you may be taking to help with your hair. If you're taking this, you need to let your doctor know because biotin can interfere with a blood test used to measure thyroid levels. So you need to stop taking them 2 to 3 days prior to thyroid blood tests in order for them to be accurate. Now, another tip is you shouldn't stop your thyroid hormone without discussing this with your physician. Most thyroid problems are permanent, and so you'll probably be required to take the supplement for the rest of your life. And it's not something you can just take it and forget about it. You need to monitor it on a regular basis. It's really important that you do your blood work at least annually, even if you're feeling fine, so that your dose of thyroid hormone can be adjusted if needed. Now, let's talk about side effects. Most people tolerate levothyroxine really well, but just like any medication, there can be some side effects, particularly if the dose is not quite right. Too much thyroid can lead to symptoms of hyperthyroidism like anxiety, insomnia, weight loss, and heart palpitation. And too little may not alleviate the symptoms of hypothyroidism. But beyond that, common but less serious side effects can include headache, temporary hair loss in the first few months of treatment, nervousness or anxiety, sweating or increased sensitivity to heat, diarrhea, insomnia, changes in menstrual cycles, and changes in appetite. These usually resolve as your body adjusts the medication, but it's important to communicate with your doctor how you're feeling. Now, rare but more serious side effects include chest pain, shortness of breath, swelling, seizures, or allergic reaction. So of course, if you experience any of these things, seek medical help immediately. Probably one of the most important things to realize about taking thyroid hormone is that you should only take it if you're having issues of low thyroid. There's a misconception out there that your thyroid, or lack thereof, is what makes you gain weight, and therefore a great way to lose weight is by taking excess thyroid hormone. First of all, studies have proven that taking extra thyroid will not help you achieve your weight loss goal, so there isn't a point anyway. But more concerning is the effect that excess thyroid can have on your body. Taking too much thyroid is really hard on your heart, causing your heart rate to go higher and can put you at risk for a certain heart rhythm problem called atrial fibrillation, as well as increased blood pressure and risk of heart disease. It can also affect your bone health, putting you at risk for fractures by causing osteoporosis, as well as lead to muscle breakdown, psychosis, thin and fragile skin, and diarrhea. So the best approach is to take it when it's determined that it's something that you really need, and then requires blood tests and close communication with your healthcare provider. But once the correct dose is found, it can greatly improve your quality of life. So we hope that you found this to be a helpful review of this common important medication. If you did, please give this video a like and share it with your friends. Your support helps our channel to grow and reach others who may benefit from this knowledge. And if you haven't yet, don't leave without subscribing and hitting that notification button so you don't miss out on any of our future content. So until next time, this is Family Med with Dr. Richardson, and we hope to see you in the next video.